Delta Care RX has been a great partner in providing hospice care. All the great features that Delta RX software has. If it didn't make financial sense to me, we couldn't do it for our organization. It makes a lot of financial sense and it makes service sense to us. It saves us money because the pharmacy consulting services helps us be very efficient in what we're ordering for our patients. But it also saves us money because it saves time. It saves time in getting the prescriptions from order to pharmacy to patient. And in the end, of course, the patient gets their medications more quickly. So it makes more financial sense to us, and it makes sense from the patient service side as well. It's been very advantageous for us all around.
Delta Care RX has been a very good experience for me. It's helped me to be more efficient. It's helped me to be more confident in the choices that I'm making for my patients and to make sure that everything is done as quickly as possible.
One of the great features that Delta RX has is secure messaging. Our nurses often wanted to communicate with one another using their phones or electronic devices so that they could quickly send a message to each other.
Delta Care RX has allowed us to bridge the gap between old and new technology. In an age where we use Facebook and text messaging and emails, they have allowed us to have access to them either by laptop, desktop, or even by phone. They are just a click away, and I can go on there and within 10 or 15 minutes get recommendations and have it on hand so that when I talk to the physician, I'm confident about the things that I need to ask them.
It's been very advantageous for us all around.
And Delta Care's been everything they told us it would be. It has been efficient, has been fast.
A lot of times we go into houses and have patients with, symptoms that are out of control, pain, vomiting, whatever it may be, and we can page the pharmacist and get a call back within 15 minutes.
Hospice of Huntington has been using pharmacy consultative services for many years, long before the COPs required that hospices include a pharmacist in their interdisciplinary team. So I'm quite familiar with the process, and I have to say I'm very happy with the Delta RX team that answers our nurses' calls very promptly.
With Delta Care RX, one of the best features for me as a practitioner is the accessibility of the previous consults. It's been very beneficial to my practice to be able to very quickly access those previous and initial consults to make sure we're doing the best things possible for the patient.
Keeping in mind that these families are at a crisis point in their life, anything we can do to increase their comfort, be it decrease pain, decrease nausea, or even increase their confidence in what we're doing so they feel comfortable in what the medicine is that they're giving their family. We feel that's very important in our delivery of services.
Physicians are going to be required to electronically prescribe their prescriptions very soon, or they will face financial penalties for not doing so. By getting on board now with Delta RX, we're able to get our physicians ready for that requirement of sending prescriptions electronically. We think we're ahead of the curve. Delta RX is really able to take Hospice of Huntington to the next level of pharmacy services, because in the past we've had to rely on a paper prescription that goes from patient to pharmacy back to patient again. And now with their instant ability to be able to communicate pharmacy needs through electronic media, we can just have our nurses prompt our doctors for renewals, or the physicians can directly access their iPads or their phones and send prescriptions just directly to the pharmacy.
With the new system with Delta Care RX, I've noticed that we get a quicker response. A lot of times we have patients that we may not be enrolling that day, but with Delta Care, the way it's set up now, we can send the information to the pharmacist and they will hold on to it until we are ready to enroll that patient. And we can enroll them through the computer system, which is a lot more helpful than our old system, which we had to wait for a phone call, and sometimes we were waiting for 45 minutes before we could get a hold of somebody. So this is very efficient.
Of using the e-tools for e-prescribing has been very easy to use and very seamless. It's been a situation where just a point and click, typing in a little bit of information, and my physician has been able to send a script directly to the patient's pharmacy.
And within 15 minutes, either a pharmacist is calling you on the phone to give you those recommendations, or they are sending you a message via fax or online.
You know, change is always hard. Even good change is hard. So when we decided to change to Delta RX, I was concerned about how we were going to roll this out to the staff and how they were going to accept the change. But you know, when we prompt people and tell them what to expect and have easy partners like we do with Delta RX, the change was very seamless. We were able to prepare our pharmacy partners, our physician partners, and our staff for being able to really communicate between Delta RX and our staff and the physicians in a very seamless way. I have to say that even our staff thinks that this was a good change and that it was well worth the process that they went through to get going with Delta RX.
I had a little bit of anxiety when there was yet something else new for us to try, but I have found it to be very easy. I'm very comfortable with it, and quite honestly, I'm very proud of myself that I've been able to do this.
Perhaps you're satisfied with the pharmacy services you're receiving. I ask you to just give a look at Delta Care RX to see all the things that you might be missing. I think that you'll be surprised.
I would recommend Delta Care RX for anyone looking for a new pharmacy consult group for their hospice service, simply because it's efficient, it's an easy system to learn, it allows me in my job to get the admission done quickly, including the pharmacy consult part, and then move on to the next patient so I can better serve my patient's needs.
I recommend that you look at Delta Care RX because they're the total package. Listen to all of the things they have to offer because it's not just one thing. It's all of the pharmacy services you need to provide excellent hospice care.